Urine hemosiderin. The urine hemosiderin test procedure involves collecting a urine sample, concentrating the sediment, staining it with Perls stain, and examining for blue granules under a microscope. Sample collection for performing test requires a random urine sample. Urine must be received in an iron-free container to prevent contamination from external iron sources, which could lead to false positive results. Equipment and materials required for test are microscope, centrifuge, water bath, centrifuge tube, pipette, glass slides, a graduated cylinder or volumetric flask, 100 milliliters capacity. Reagents required are methanol, 2% potassium ferrocyanide. Make it by diluting 2 grams potassium ferrocyanide in 100 milliliters of distilled water. 2% HCl solution. Make it by diluting 2 milliliters of concentrated HCl in 98 milliliters distilled water. It's appropriate for the acidic environment needed in the Perls reaction. Working stain solution. Prepare it immediately before use by mixing equal quantity of 2% potassium ferrocyanide and 2% HCl solution, and keep at 37 degrees Celsius in water bath for 10 minutes. Hematoxylin and eosin, H&E, stain as counterstain. Absolute ethanol, used for dehydration and to remove excess of stain. Quality control. An iron-positive unstained slide of bone marrow is used as quality control for ensuring the stain is working correctly. Procedural steps. Centrifuge 5 milliliters of urine at 2,500 RPM or 1,200 G for 15 minutes. Place the deposit on a slide and spread out to occupy an area of 1 to 2 centimeter. Dry in air. Fix smears in methanol for 15 minutes and let it dry. Pour working stain solution and leave for 30 minutes. Rinse the slide under running tap water for 20 minutes. Counterstain with hematoxylin and eosin, H&E, stain for 5 minutes. Wash with distilled water, then with absolute ethanol to remove excess stain and dehydration. Air dry and examine microscopically, 40x objective. For blue staining hemosiderin granules 1 to 3 micrometers in size, seen both intracellularly or in epithelial cells and extracellularly. Results are given as hemosiderin in urine absent or present. Here is in classical positive urine for hemosiderin as blue-stained hemosiderin granules seen in epithelial cells. Endnotes. The urine hemosiderin test is a diagnostic procedure aimed at detecting hemosiderin. It often linked to conditions like hemolytic anemia or chronic venous disease. Because hemolysis is intravascular, useful confirmatory tests include serum haptoglobin estimation and, when the condition is chronic, a Perls stain of urinary sediment to detect the presence of hemosiderin. Its insoluble form of ferritin, which is visible microscopically. Perls staining, also known as Perls Prussian blue, is a histochemical technique primarily employed in histology, histopathology, and clinical pathology to detect the presence of iron in tissue or cell samples. This method, named after the German pathologist Max Perls, 1843 to 1881, who first described it in 1867, is particularly effective for identifying non-heme iron, such as ferritin and hemosiderin, rather than iron bound to porphyrin in forms like hemoglobin and myoglobin. The core principle of Perls staining involves the reaction between ferric ions, Fe superscript 3, in the tissue and potassium ferrocyanide, K4Fe, CN6, in the presence of hydrochloric acid, forming an insoluble, bright blue pigment known as Prussian blue or ferric ferrocyanide. This reaction allows for the visualization of iron stores. Reference: Dacey and Lewis Practical Hematology 12th edition. Thank you for watching.